Not too bad, thanks for asking. It's called, so, you, why are you here today? What's going on?
Oh. I have pain.
Okay. Where do you have pain?
Both my hands and my elbows. My low back kind of hurts recently.
So you have pain
my knees.
One more time?
Hands, my elbows, my low back, knees. You didn't let me finish. Sometimes my hips hurt.
Okay.
Morning when I get up. Yeah, that's not good.
So where's like your chief complaint of pain? Where is it really coming from?
Oh, my low back hurts.
Low back? Okay.
It's terrible.
No problem. So how long has this been going on, you say?
It's about 3 years.
3 years, okay. And can you describe on a scale of 0 to 10, 0 being no pain at all, and 10 being the absolute worst pain in your life, where you are?
About 8.
8? Okay, and is it always like that? Or is it better sometimes?
Always.
8?
Always.
I don't believe you.
Okay. So do you have anything that's better?
Too tall.
I don't know. Ice, heat.
Nice and okay. Position changes possibly?
Yeah.
Okay. Alright, so, no problem. So you have back. And can you show me on your body where the pain is? You can actually stand up and just show me.
Oh, standing up is terrible.
Standing up is terrible?
Yeah.
Okay.
But my low back.
Your low back?
It diffused. I just got that word.
Perfect.
My email
So,
today.
and how old are you? How old is you? Your past medical history?
72.
Alright, and any kind of like past medical history, like anything important I should know, like family history, cancer, anything like that?
My dog died. I think he had a tumor.
Tumor? Okay, doc, great. Anything about like, smoking, drinking, anything along those
I
lines?
don't know.
No?
But just straight in hell.
And can you describe the pain to me? Like,
It's achy, it hurts all the time.
achy and
It's
it hurts all the
tingly,
time.
it's burny, it's stabby.
Okay.
It's terrible.
Achy
It's an
and
8 out of 10.
No problem. Alright, so just before we kind of get started, just want to make sure that some other things are kind of clear. Do a peripheral joint scan.
I appreciate that.
Have you just kind of cross? I want you to stand up for me.
Where's the stand up? Once I'm there, it's still an 8, but.
Can you put your arms up here for me? Okay, I'm just gonna stabilize your hips. Can you rotate? Can you go off to actually the other side first?
Ow!
Ow.
Yeah.
Okay. Other side, please.
No, it's not bad.
Okay, not as bad. All right. Can you do something called we have a little squat test? 72. I know it's a little bit difficult, but I want you just to try to bounce twice and come back up. Any problems? Awesome. Okay.
That hurt my knees and my hip.
Okay. From here, can you also go down to your knee?
Stiff.
Stiff. Okay. Other side.
Stiff, hurts.
Okay. So just rotating off to your right side hurts a little bit.
Hurts a lot, but better eat.
Okay. No problem. Okay, so again, through the joints. So again, from here, we're just going to do some basic observations. Do I notice anything? Do I see any kind of swelling, any kind of redness, any kind of bruising on the back?
Decreased lordosis.
I have sports bra on if you want.
That's fine. No, not going to get that far yet. I'm sorry,
I'm not going to get that far yet.
Okay, no problem. Anything,
God, Nicole, let him buy you dinner first.
Okay, so from here, what we're going to try to do is we're going to move into your active range of motion. So again, if you can, I want you to try to touch your, try to touch your toes if you can. Is there any pain with that motion?
A little bit.
A little bit?
Yeah.
All right, just at the end.
8 out of
Just
10.
at your hips. Okay, not in your back though.
Well, a little bit.
Okay, so again, come back on up. All right, I'm not going to do it over pressure because they have pain. So again, I want you to actually go to the back.
I can't do that.
You can't?
I
It
haven't done
hurts?
that in years.
Okay, so that hurts right away. All right, you go off to your side then again, just really quick.
Yeah, that's about the same as earlier.
Did it hurt a little bit?
Yeah, that one hurts too.
Okay, so again, active range of motion has pain in all directions, which leads me to go to passive range of motion because I want to get the end feel. I just kind of see the mechanics of the motion. But passive range of motion for lumbar is difficult, but we can do it. So if you can actually lay down for me on your stomach. that'd be great.
Oh golly, my stomach.
Well,
My pain is now 9.
is it really at 9? Okay, so 10 positional changes. Okay, so just doing some passive range of motion here. Again, what I'm going to
You got a
do
broken femur at least.
is, this is obviously an
No, that's
outside
10.
table,
He's getting burnt.
but I'm just going to put them into side bending. Any problems there?
Yeah, that hurts.
Okay, does that hurt?
Yeah, that hurts.
Okay, and then trying to go into extension, that hurts obviously.
You had it.
Alright, let's say you go onto your stomach, onto your back please for me. Thank you. Okay, and then can you bring up both your legs here? Any problems here? Does that hurt or anything? Okay, good. So passive range of motion will also elicit pain and feels of both side bending
He doesn't have any pressure doing it.
and
You know what I mean?
extension, as does active range of motion. But passive range of motion flexion and active range of motion flexion are really not that big of problems. Moving on to myotones, lower extremity. So if you would be so kind for me, can you bring this leg, just bring your knee up for me? Fantastic. Let me, so you guys can see it though, that's what I'm going to do. Let's have you go like a second, sideways. Okay, let's just do this leg first. So knee up, here we go, ready? So okay, don't let me move you, okay? Ready, go. L2, L3.
That hurts my head.
Hurts your hip.
Yeah, but it's strong. No way.
This is L1, L2, excuse me. Don't let me move you, okay? You keep solid, ready? There's L3. There's S2. Leg down, please. Leg down. All right. Well, then she'd have her feet on the bed. And again, we would do L5 would be, so don't move your foot, okay? Ready? This is just, again, dorsal obliques, but this is, actually L5 is toe. All right. Then S1 is going to be lateral side of the foot. We're not going to let them move out. Ready to go?
L4, L5 is weak.
L4, L5 is weak and painless. Okay. L4, L5. And then again, don't let me push your foot. Ready? Okay. There you go. That's S2. L4, L5 is weak and painless.
Bilateral.
Bilateral. Okay. Again, you do both sides. So L4, L5. Okay. So then from there, myotones, I'm going to go into functional tests, have her do the ODI or the lower extremity test. And where is she?
94.
94? Okay, so, there, whatever. Okay, so, just, okay, it's force. Okay, so special tests. What we're going to have you do here is we're going to have you actually go back onto your, let's have you go onto your side here really quick. Well, just because putting you in the prone makes it very difficult.
All right, just a second. Rob, where does she have?
Pause the time, please, so I can.
L4, L5.
That's fine. L4, L5 hurts with extension, not flexion.
Gotcha. So if it's extension or flexion, then it's going to be.
So we have a disc.
I'm sorry.
What
I
else
wasn't
would
paying
she
attention. I'm sorry, what?
What else would she have?
It's a good guess, but I wouldn't say she has. I would say possibly.
Differential diagnoses.
Oh, I have no
Give me
idea.
another one.
Something else. Come on, guys, you got this.
72. What's an old person going to have? Osteoarthritis. What else could they have? Maybe I'll know. You're going to have to list them.
Degeneration of the disc.
That everybody has degeneration of the discs. That's not going to work.
He almost
Still doctor
said-
for it. You won't.
Spondylolisthesis.
Oh, yeah.
What else did you say?
Spinal stenosis. Ooh.
Wow. Who said that? Nice. Automatically, when you do this a couple of times, you kind of get the idea of like, it could be, it couldn't be, but like, when he said right away, flexion, I don't really feel anything, a little bit of pain, and then like, oh, I can't do that at all, automatic telltale sign of a disc herniation or a spinal stenosis. Do you know which one? No. Does it matter? No, it doesn't. You're not a doctor. But you do know that it's something like that. Can you treat this? Yes, you can. Unless you have a lot of problems, and we'll get into that later. So again, I'm
That's a
not
sign
even
of
at my
cancer.
special test yet, and I already have a strong idea. So this is where Dr. Dillon or Dr. Richardson are going to be like, what do they have, or what do you think they have? And you want to have the idea of not, you don't want to say they have this. You want to say in a very eloquent way, I believe through my years of training or teaching that they have symptoms of this or symptoms of that, which would lead me to believe these. I cannot rule these out yet. I'm going to leave to these special tests. What I'm going to tell Aaron is, as Dr. Dillon or Dr. Richardson is, I'm going to choose a femoral traction test, which tests an L3, L4 area, because there's an L4, L5 weak and painless with the rims, which would lead me to some kind of nerve problem. I'm also going to have to do dermatomes. But what I'm going to do here is, it doesn't matter what side, I haven't gotten any kind of reproduction on any of a certain side, but it doesn't really matter. If I get a positive on this side, it's going to lead me to an L3, L4 problem. Does that make any sense?
Yeah.
Is that wrong? Do you have any questions?
Comments.
Beliefs? Okay, so what I'm going to do here, you want to explain the test out to the patient, but you wouldn't do it in the clinic. You're just doing it so he understands, you understand. That's the only joy. All right, so again, I'm going to just take your leg, I'm going to put you in slight abduction. There's some points right there. It's not just a pure like this. I'm taking you in a slight abduction. I'm going to bring your leg back, and if you feel any pain in your groin, your hip, anything like that, or numbness or tingling, no? Okay, that rules out L3. I'm going to flex your leg.
Oh, my tibia hurts.
The tibia hurts. That's an L4. So with that test, I'm possibly thinking L4, so when I go to my palpations and things like that, I know where to kind of look. If that makes any sense. What other tests can I do? Because it's nerve, I would try to put them in a prone knee bend, which is L2, L3, but it's another nerve test which would just kind of elicit that there's a nerve problem. You want to have two just to be double sure, or not sure. I'm going to put you in prone. Again, this is going to cause them a lot of pain and problems, but they have to be tested. So I'll tell you more. Right, so, but in a loving way. So again, I'm just going to have you take this leg, and I'm just going to try to put your heel to your back. Do you feel any problems, any pain, any reproduction of symptoms?
Yeah, that hurts.
Okay, yeah, that hurts. Here's the trick. These are getting the lower tests that you might not have had, but what we were figuring is that, what test am I doing here?
The prone knee bend,
Yep, the prone knee bend, yep. Is there any other test that looks similar to this?
Yes.
What test is that?
The one on the side, the oral.
No. Like in this position, like right now, if I don't change anything, what other
You
tests?
haven't done tibia, have you?
No.
Okay, then they wouldn't know that. Okay. Then never mind. Okay, but then again, you'll learn that later then. So again, here, again, that's going to be indicative of an L2, L3 kind of problem. So again, is that it's around the same area. So I have a lumbar L2, L4 region to area to look, region, excuse me. So from there, I did some special tests, the porpoise region, for some reason. Now I'm going to go into reflexes. So, okay, so I'm going to have you kind of sit up for me here. Just kind of sit up on the edge. Okay, so how you feeling right now? You doing okay? You feel dizzy? You feel tired? Achy, pain, anything like that?
About 8 out of 10.
8 out of 10 still? Okay. You want to always reassess the patient and kind of ask how they feel with your treatment. It hurts, and you're being kind of mean. With my kinesiology skills, big hint, I'm going to palpate the patellar tendon. I'll do this side here so Aaron can't see what I'm messing up. So I'm going to palpate, and then I'm going to make sure I have the patellar tendon, and I'm just going to tap it, and I should see something. This is a grader on a scale of 0 to 4. 0 means no response, 1 means diminished response, 2 means normal response, 3 means hyperactive, and 4 is hyperactive and close. And your response is like a 2.
Yes.
Okay? You want to state everything because that's what you're looking for. We're masters of movement, not athletic trainers. Okay, S1, again, same thing. I'm just checking, and what do I see? Grades.
That was impressive acting.
That was actually normal.
It was normal.
Normal? Okay, so again, grade 2. So in my documentation, reflexes, level 2 or grade 2. Joint play. So now when I go to the back, if you can actually lay on your stomach for me, please. They know.
If you're which one?
Or do we not?
Yes.
We know yes.
Okay. Yeah, you guys had joy of person up here. Okay, so what I'm going to do here is I'm going to do central or unilateral PAs. I'm going to start probably unilateral first. First thing I'm going to do is I'm going to show off a little bit and show my kinesiology skills. You're saying, why am I going to do this? Because I'm putting things together. I'm not just an automaton. So, here we go. I'm checking PSIS. PSIS, why would you do that? Is it tender? Oh, snap. That's not where we were. Okay? I'm checking S2. Why am I checking S2? That's for the center of masses. From kinesiology, a lot of problems, if there's any kind of major biomechanic problem, it's going to be there. Well, it's going to be, it's more likely going to be affected. I'm sorry. palpate S1 on skin. Then I'm going to go to L5. My hands are kind of cold, I'm sorry.
Yeah, that's good. That's
Okay.
about that's about an 8 out of 10.
Okay, 8 out of 10 on L5. Now I'm just lightly touching. I'm going to do unilateral PAs. Does it feel more on one side than the other?
The left side hurts a little
Left side, okay. How about here, going to L4?
bit.
Better or worse?
A little better. About an 8 out of 10.
How about this, L3? How about L2? Okay, so again, see how I'm communicating with the patient, but I'm trying to put my things together. It's worse at L4 to L5. Anyway, L4, L5 is going to be a major area of focus. So again, I just did some palpations, and then a joint plate, excuse me, and then like the palpations are also, I've already kind of looked at it, no redness, no kind of scarring, anything like that. You had to kind of x-ray anything along those lines?
I had an MRI about 10 years ago.
10 years ago, wow, that's
Something like that.
useful. Okay, so, just busy with that, if I had to stop right now with whatever time I have left, I'm not asking about the x-rays I already did. I did some joint play, you don't have to do anything with the hip. I cleared the top and bottom, I did special tests, I also did the straight leg raise, I probably should have done that too. You guys want to see the straight leg raise? Do you know that?
Yeah, we know that one.
Okay.
But go ahead and do it.
Okay, turn over onto your back then. Okay, so, just tell me if you have any kind of pain anywhere, okay? Ready? Set, and here we go. Any pain?
Always there's pain.
Where is the pain?
Back.
Okay, is it all the entire time? Is it more painful when I'm up here?
It is.
Is it? Good.
Good.
How about this side?
I'm about the same as the other side.
Oh, okay. So, now I'm going to do bilateral. So, just with that, is he lumbar or neuro? Lumbar, SI, or neuro? Do you know? Lumbar? Just wait. Is it lumbar, neuro, or SI? Right now, just with that. Just okay. Who thinks it's, don't be scared. Who thinks she's got a neuro problem? Raise your hand. Raise your hand, it's fine.
Wait, where was the pain at?
So, okay, pain, unilateral, we're doing unilateral. Don't look at your notes. So, pain is past 70, this is past 70.
70 means SI.
Just, okay, who thinks pain is lumbar? Raise your hand. How many think it's SI? Okay. Right. So, if you go below 70, it's neuro with the unilateral. Bilateral, it's lumbar or SI problem. You've got to go back bilaterally and rule them out. You don't know. That's a trick that one of the teachers will tell you. They'll say, well, is it a lumbar or SI problem past 70? And you'll be, I think it's lumbar. There's no objective difference or change because you've only done unilateral. You've got to do bilateral too. So now I take both legs, below 70, any pain? Past 70, any pain? Ah! So what does that mean? Lumbar. There you go. So lumbar matches up L4, L5 area. It's a lumbar L4, L5 disc or stenosis. Do I know the difference? Do I know if there's an actual stenosis or disc herniation? Not really. I think there's a couple ways we could really tell, but officially on a medical chart, we can't say anything like that. We just know there's some kind of musculoskeletal or neuromuscular problem. I would also, when she's on prone, palpate the musculature and see if it's tight. It probably will be because she's 72 years old. And she probably also has osteoporosis. Again, she probably has osteoporosis. She's 72. Okay. Yeah. So again, you're not going to be doing like an Insanity or a P90X with this lady. But, so just from here, okay, so ask me ask me what I would do with this patient exercise-wise. Or whatever. What's my treatment?
As a 72-year-old, want exercises.
Okay. Do you guys have to do interventions?
Yeah.
Okay.
4.
So again, 4. What?
Like you teach short-term goals to long-term interventions.
Goals?
Yeah.
Well, that's, good luck with that. That's Aaron for you. I use my fin scars on the goals. Okay. So from here, exercises are that you guys have to do. Let's head go onto your back, please. So, not goals, but for exercises, you have to do 4 exercises. Is that correct?
And then
2 exercises. So from here, we're having you. This is kind of a cop-out. This is kind of like a slacker version of what you do as a PT. Okay, let's just go with some things. She's 72 years old. She's an older female, obviously, so, and she's got osteoporosis. So generalized weakness. What is one area where we can hit like a lot of birds with one stone? Bang. So, a core exercise. Now you're saying, well, how would that help? Well, I'm doing core, I'm also doing some flexion stuff, and she likes flexion, not extension. So I'm actually doing two things at the same time. And I'm showing my critical thinking as a physical therapy student, not by chance, by the way. Alright, so again, from here we have something called the draw-in. The draw-in can be done with a blood pressure cuff, or it can be done without a blood pressure cuff. But like you as a PT are going to palpate right here, and I want you to bring your belly button to your spine for me, okay? I want you to hold that for 10 seconds, 10 times, okay? And now you're saying, now if Dr. Dillon were to ask me something like, can you show progression on this exercise?
Yes, you can.
How?
Using your
First
first
time
time
you ask the
legs.
legs.
That's right. There's actually a kind of a documented progression. I don't know if you have to know it or not, but like, this is stage 1. Stage 2 would be she has to add heel slides.
Oh.
Stage 4, she has to like have one leg up and she's doing leg raises. Stage 4 or 5 is bridging, so put your legs down. And then holding bridging like that. Stage 5 would be standing and holding it. Stage 6 would be doing the, like doing some kind of exercise with holding it. And stage 6 would be like walking and doing it. I've progressed her. She's only probably got like 10 visits. I guarantee you I can do this to the dogs come home with her. Like, I mean, I can progress this or regress it any way I want. Another exercise I could do
What if she doesn't have a dog?
is, what's another exercise I could do? I don't know. Maybe you have any top exercise that's really kind of simple. Pretty much core. You could have her do like a pelvic tilt is another big one. Or I was going to say that bring the legs up or whatever, but yeah. A pelvic tilt is a good test, is a good exercise, but again, make sure the patient understands what you're talking about, because they get, a lot of, essentially 72-year-olds get very confused on what's going on. So what I want you to do is, I'm going to palpate the ASIS, again, showing the kinesiology, and I'm going to have you bring your pelvis this way, okay? Yep. No, I don't want you to raise your bottom off the floor. I want it more like just moving here, just like that. Good. So again, I also have my hand here on the back while she's doing it, making sure she's not compensating or cheating. You want to make sure she's doing it the right way and she's not learning it the wrong way, because when she goes home and does not do the exercises, or when she does do the exercises, she's doing them in the right fashion. But both those exercises are opening the facets, which will allow relief of her irritation. You could also done a slope test on her too, would probably been a big one to do. But from there, that's what you're going to basically be able to do. What Aaron and I learned was that mnemonic pull, for some reason, just plain dumb. And that allows you to very quickly get through an eval, orthopedic, like in under 30 minutes. Do you guys know what I'm talking about, or no?
Yes.
Okay, good. They said, and the big thing we learned was, you have to do a goniometry measurement, or no? No, okay. Do we have to do goniometry? I thought we had to do a goniometry. Yeah. But no, that's basically it. Do you have any questions? Or we have a differential practical on Wednesday, and I have to review my exam eval skills because I obviously suck. And
What?
yeah.
What?
Crap, man. I'm failing then.
Yeah, I know.
But no, if I can work with some of you,